Okay, today, inshallah, we're going to continue on telemedicine, and hopefully we finish it and start on hospital information systems, inshallah. Okay. So basically, the last thing we stopped at last time was before this part here: image data, privacy, authenticity, and integrity. It's very important to actually learn about these terms. These terms are very important as far as any transmission over the internet in general. Okay. So basically, the basic idea here is that image transmission in teleradiology is mostly done through public networks, meaning that we are sending everything over the internet. And basically, we all know that the internet is a public domain. Basically, you can send anything, you can have everything. Basically, you can send anything, anybody can send to anybody, or basically anybody can post on the internet and anybody can access the internet. So basically, we have to make sure that basically our data is private, because basically this is one of the basic things that we saw in HIPAA. We have to make sure that it's authentic, and we have to make sure that its integrity is maintained. Okay, so basically all these are related to trust in the image data that we send. Basically the trust is characterized by three things: privacy, authenticity, and integrity. Okay, and this is basically a very important issue because basically of the standards that we talked about before, of the HIPAA standard that maintains the importance or the requirement of having all these three things. First of all, privacy means that denial of access to information by unauthorized individuals. Basically, if you're talking about medical data are not supposed to be accessible by anybody. They are supposed to be accessible by only those who need it, basically for the delivering the health care to the patient. You cannot make it accessible to anybody else. So as we said before, we have access authorization, where we have different levels of access to patient data depending on the need for that access to deliver the treatment or the diagnosis or whatever. So basically, we have to make sure that privacy is maintained. Whatever we send is only basically accessible by the consultant. Nobody else can read it but the consultant. Okay, so this is very important. So privacy is related to denial of access to information by unauthorized individuals. So basically, if I'm sending the information to the consultant, Dr. X, he's the only person who can access this information. On the other hand, authenticity refers to validating the source of the image. We said before that some of the attacks actually, like man in the middle, okay, man in the middle, basically, or meet M, basically. This is one of the things that we saw in the cybersecurity part of this course, where actually somebody can be in the middle between two people communicating, and basically he's receiving the information in the middle, and he can actually modify or basically change the information in the middle. Okay, so authenticity means that we have to make sure that the source, if I receive the images from a certain source, I have to be able to make sure that this source is authentic, or basically validated. I can validate it somehow. Okay, so this is extremely important. So basically, if we don't have that, maybe somebody can send the information, can send some images or whatever to a consultant, or basically somebody can claim to be the consultant and sends a report that is fake. And basically, this makes the whole thing basically meaningless, basically. So basically, we have to maintain authenticity to be sure that whatever we're sending to the consultant comes from the referring hospital, and whatever comes from the consultant is really coming from the consultant. Integrity refers to assurance that the image has not been modified. Okay, meaning that basically I'm talking about modified accidentally or deliberately. Okay, meaning that accidentally, meaning that I sent something that that doesn't contain the whole data set, for example, or basically by mistake, or somebody intercepted the data and modified the images and basically sent it, like man in the middle attack. Okay, so basically this is a deliberate attack on the integrity of the data. Okay, I have to make sure that whatever I'm sending is can be somehow validated at the consultant side, so that I can make sure that the data arrived safely, basically without any change. Actually, this is very common. Actually, in whenever you're installing a program from the internet, some sites actually would add something called you have a code, like what do you call it? Um, like basically like some kind of a verification code where you can actually basically use it with the program to make sure that the program is basically unmodified. Because sometimes some people actually put the same program with a malicious code inside and post it on the internet, so some people can download it and basically think that it's the original one, and basically this can be a source of distribution of malicious code. Okay, so basically you have to have something like this. You have to have a way of validating this. Okay, so basically this is very important. The first two here are the responsibility of the public network provider, basically. So basically the general internet that is used for every other application has ways of maintaining privacy and authenticity. So basically, if you're sending the information basically as a on a secure website, basically the security of that website or the encryption that is used to send the data is the responsibility of the public network itself, public network provider. Okay, so basically this is done by encryption, and authenticity is also the basically if you have a browser, and this browser has a certain what's called a security certificate. If the security certificate is fake or if it's modified, you should actually get a message from your browser. So basically, this is also one of the things that the public network provider does to maintain the authenticity of whatever is sent on the internet. So basically, the first two are maintained by the public network provider. On the other hand, the integrity, which is related to the kind of data that you're sending, and only you knows what you're sending. Basically, if you have certain kinds of images or whatever, it's very difficult for the public network provider to know exactly what kind of data you're sending and what kind of attacks on the integrity of the data that might happen. So basically, it's very difficult for the public network provider to give you tools to assess the integrity of whatever you're sending. So basically, you have to do that yourself. So basically, while privacy and authenticity are the responsibility of the public network providers, based on firewalls and password technologies, basically related encryption, things of that sort, integrity is the responsibility of the end user. The end user meaning that if you're a hospital or you are a consultant, basically you have to have certain tools shared between the two of you so that you can actually maintain the integrity of the, or at least have the tools to validate the data and make sure that no changes have been basically made to the data while in transit between the source and the destination. Okay. Usually, image integrity is maintained mostly by using what's called digital signatures. And basically, it's combined with encryption during the generation of the images itself. Basically, while you're preparing the data to be sent, you actually use such technologies to be sure that whatever you're sending is basically can be validated at the destination. Let's look at that in a little bit more detail. The basic idea, first of all, let me tell you that I actually saw the early developments of this technology actually while I was doing my PhD. One of the professors at my university actually established one of the first companies that does that. This is actually what's called data hiding, basically. If you have an image like this, you can actually have a signature added to that image, and it would look exactly the same. Basically, if you look at the image, you don't really realize that it has a signature. But actually, there is a way of getting that signature back from the image, and basically comparing that signature to something that the receiver should know. Okay, so basically, for the untrained user or for anybody else other than the person who generated the data, he would not know where the signature is within the image. Okay, basically, if I took an image like this and changed a few bits in every one of the pixels here, it would not appear. The image would look exactly the same, actually, because basically the changes here would not actually be caught by just by looking. And basically, if you do that and basically encrypt also whatever you're putting here, it's going to be really difficult for anybody to be able to know where the signature is. So basically, the basic idea before we go into the details is to hide a message within the image itself, and basically make sure that this message has basically it's actually derived from the original image itself. So basically, if I have an image like this, maybe I can add all the numbers here, and if I add all the numbers and basically put the summation of all the numbers here in a message inside the image itself, and whenever I get the image, I retrieve that message and compare the number, compare the addition of all the numbers here to the one in the message. I can make sure if the data will basically change in the middle or not. So for example, if I have an image that looks like this, 1, 2, 3, 4, if I get a what's called checksum, okay, this would be basically if I just add all these numbers, 1 plus 2 plus 3 plus 4, 3, 6, 10. It's going to be equal to 10 here. And basically, whenever I send this image, if I receive it like this, 2, 2, 3, 4, what I do here is I calculate the checksum here, and the checksum here will be what? Will be 11. Okay, and I compare it to 10, and it's not exactly 10. So basically, I realize that it's not the same. This is the idea. The main thing here is that you're not sending the checksum basically in a separate message. You're hiding the checksum inside the image itself, and you're agreeing with the other party on a way to find that message before you calculate the checksum. Okay, so basically this is a way of doing this. One other thing, just to make sure also that the image is actually coming from you, is to have a signature also, to embed a signature inside the same image with the checksum. So basically, I can get the original image, and I have a signature here. I can basically go over the black parts here, or even the white parts, as long as I know exactly what I'm doing. I can actually embed that message inside the image. Basically, if I add the two here, basically the signature embedded is going to be exactly, if you compare these two visually, they look exactly the same. It's extremely difficult for anybody who doesn't know where the image signature is to basically realize where it is, because basically there are so many places here where it can be found. Once you do that, you add to that an encryption. You just take this image and encrypt it. Okay, encryption in general, basically encryption is one of the things that you use actually when you do something like if you use WinRAR or something like that, you can actually encrypt the content of the WinRAR. Okay, so basically, if you read the WinRAR file itself, and you have Word files inside the WinRAR file, it's going to be really difficult for you to know where the Word file is. So basically, this is exactly the same. So basically, I add a signature, and basically take the image with the signature embedded inside of it and encrypt it. So basically, I have two layers of security right now. Adding a signature that actually relates to the way the image was generated, just to make sure that the integrity of the image is maintained, and basically embed it inside the image and do encryption for the whole thing. And then I take this and send it over the public network. If I send something like this on the public network with proper encryption, it's going to be extremely difficult for somebody who intercepts such data to know that this is an image. Okay, to basically, if it's intercepted, basically it's going to be basic garbage, but you know, to the person who reads it. Okay, and basically, even if he tries to change it, I would detect that on the other side, as we're going to see now. Okay, so basically, this is what happens in the source. At the destination, basically, I get this same thing here, and I do decryption. Basically, I reverse the encryption here, and this is basically possible. And the encryption basically can agree with the source on a key, certain key for the encryption, because basically, as we saw before, encryption needs a key. Okay, so basically, and I can agree between these two on how the key will be transmitted, and basically be able to decrypt the encrypted image and get back the image with the signature. Okay, so basically, what I do here is I have a way. I already agreed with the source on how the signature was embedded inside this image. So what I do basically is just get the signature. I get the signature from here, and basically detect the original signature, the signature that you are expecting from the source, and you get another one from the image that was transmitted, and you compare the two. If the signature matches, then you are fine. The image was transmitted successfully without any modification. The integrity is maintained. If there is any change between the two signatures, if the signature received was different from the original signature that was agreed upon with the source, then there might be a problem. Okay? So basically, you have multiple layers of protection here. You have a signature, you have encryption, and basically, if there is something that modified this data here, you will not be able to decrypt it properly. You would detect automatically that there is a problem here. If there is a problem or a modification in the source image, the signature will not match. So basically, whenever you compare the transmitted image signature to the original signature, you will find a mismatch, and basically you can detect that the image was not successfully transmitted, and basically request retransmission. Okay. Changes might happen, by the way, due to problems over the internet. Okay, sometimes actually, whenever you download a large file, sometimes the downloader actually can have mistakes. And basically, whenever you check at the end, basically you can download a zipped file or an archive, something like that. And when you try to open it, it would tell you that there is a problem with the archive, or there is a corruption in the file. Okay, so basically this can happen basically accidentally during the transmission. But on the other hand, it can happen actually deliberately if there is a hacker trying to intercept the data and modify it in the middle between the source and the destination. Either way, you can detect it using this method, basically. If you compare the image signatures, the one that you expect from the source and the one that you actually derived from the image that was embedded in the received image, if there is a mismatch there, then you know that there is a problem with the image integrity. You reject that image and request retransmission. If it's the same, then you actually can confirm, or you can validate the integrity of whatever you receive. Is that clear? Okay. If you have issues,
sorry, Dr.
yes, go ahead.
You mean that the sender send two type of data, which is the image and the signature?
The signature, yes. Signature is like you have a certain code or whatever. Okay, you have a certain block of bytes basically, and you agree that this is something that is unique, and you agree upon that signature with the destination, so that you can, whenever you embed that in the image, you know how to actually embed that. You know how to actually get the signature from from the received image, and you compare it to the original one to make sure that it's exactly the same. Okay, embedding images like this, embedding data within images, has been one of the very flourishing areas in computer science. Basically, I think it's kind of a field called steganography, okay, which is basically one of the things on how to put some data or inside any general image, not just for medical images. You can actually transmit data of different kinds inside images. Okay, and the basic idea is that for each one of these pixels, if you made certain modifications in each one of these pixels, they will not appear very different. They are going to be close to what they look like, to the human observer. So basically, it's a way of sending information or hiding information from users. Basically, this is used in many applications. By the way, one of them is to maintain the for example, if somebody has a copyrighted image, for example, and this image has been distributed by another person, he can actually prove that this image is his because of embedded signatures. So basically, this started actually in that area because basically people had journals and if you have magazines and things of that sort, they have certain copyrighted images, and basically they want to basically sue other people or basically take people who distribute these images without permission to the court, okay? But they didn't have proof, basically. They can say that, other people say that it's a little bit different. Basically, it's not theirs or whatever. If they have the signature, if they can show that the signature is there, then it's theirs, okay? The same way, actually, you can use it here between the source and the destination in telemedicine to validate the image. So just make sure that this image came from this source and this image is proper. This image didn't have any change in the middle between the two, the source and the destination over the public network. If there's any change to the image, then it's very likely that the signature will not remain the same, because any change in the image will affect the signature, because the signature is usually distributed over the image. So basically, any change in the image would affect the signature. So when you compare it to the original one here, you will find a mismatch. Okay? So basically, if you're talking about lossless digital signature embedding, basically you have a medical image here. You have a way of signing, basically, which means that you have certain block of information that you consider as your signature. So basically, you have the signature here, and you have your original image here, and usually you get the signature here as something that is calculated from the image. Usually, don't consider the signature as your name, for example. No, I mean the signature here is something that was calculated from the image itself, so that it can maintain the integrity of the image. For example, if I have the checksum, for example, this can be a signature because basically it's unique. If I add all the numbers in the image, then I can get a number that is unique to this image. If one bit changes in the image, the checksum will not be the same. Okay, so basically this can be a very good signature because it has a lot of information. It contains information about the image, and it would actually be different if anything changes in the image. Okay, so you get the image and calculate the signature from the image itself. You agree with the other side on how the signature will be. Okay, so basically it's agreed upon how you're going to get that signature so that the other side will know how the original signature should look like. The embedding process here takes the image, the original image, and the signature, and basically embeds the image here. You get an I star here, which is a signature embedded image. You have an image that visually looks exactly the same as the original one, but it has information, okay? And it's very easy actually to do that. I can actually probably show you how to do that. It's very simple actually, and you'll be surprised that you can put a lot of information inside an image, because actually it's you have a lot of pixels, and basically if you change, if you consider, for example, if you have a 128 by 128 image, for example, okay, you have something like this. If I use the least significant bits in each one of these points here, then I can have 128 bits here by 128. Okay, so basically if I add basically 128 is like, I think it's gonna be 32, 16 bytes times 128. So you're talking about almost, this is, if you multiply this by 8, this is gonna be like 2 kilobytes. Almost, okay? So you can put 2 kilobytes of information if you just use the least significant bit, okay, for each one of these here. Okay, and if you change the least significant bit, I assure you the image would look exactly the same. Okay, so basically this is one of the things that can be used very effectively. And 2 kilobytes actually it's very much enough if you want to put something like the checksum, if you want to just book a signature or a simple message, something like that. It's very easy to put them or fit them inside 2 kilobytes of information. Okay, so basically the way embedding happens, there are a lot of methods actually. You can actually look into things like that. And one of the things that I will ask you to do in the last project is to look for methods that do that. Okay, report on, you know, a few techniques that do things like that. On the other side, this is a sign and embed. You sign, get the signature based on the image content, and embed that signature inside the image. And then this image is encrypted and sent over the internet. Encryption, by the way, is a part of the public network work, by the way, because basically if you have a secure website, for example, then the information will be encrypted between you and that website. Because basically, if you remember that whenever you're purchasing something from an online store, if your connection is secure, if your connection is HTTPS, basically you can actually enter your credit card information without having to fear for loss of information, or basically somebody else looking at your information or grabbing the credit card number or information. Basically, this is the responsibility of the public network, but actually this is the responsibility of the end user. Okay. On the other side, you get the signature embedded image. This actually arrived here after it was encrypted and decrypted on the other side, and you start the extraction process. Okay. The extraction process actually depends on how you actually did this. Basically, there is a way, as long as you know how you embedded the signature, you know how to extract it. And whenever you do that, you get S dash and I dash. Okay, the verify process actually, what it does is it takes I dash and uses exactly this block here. Okay, and compute the signature that was supposed to be, or whatever the signature from this image, how it should look like, and it compares the signature that was received from the original, from the embedded image here, to the one calculated from the received image after I remove the signature. If these are the same, then it's okay. Then it was transmitted without any problems. If they are not different, if S is not equal to S dash, then basically this is not right. Something happened in the middle that distorted the information or changed the integrity of the image. Okay, so basically I have to reject the image. Okay, so basically this method actually is called lossless data signature embedding, because basically what you're doing here is you're doing something that basically it doesn't change the actual content of the image. Basically, if I get the embedding process here, for example, I can add the signature to the least significant bit. That's basically, if I add, meaning that I can actually subtract and basically get the same image back. So basically, the way I do the embedding here, I make sure that I can go back here and do the extraction without any loss of information. Okay, so basically there are so many different techniques that allow you to do that. So basically it's lossless digital signature embedding technique. This is used here, and it's used actually in several other fields, by the way. Okay, for example, for Adobe Acrobat, for example, you can actually digitally sign the document, and basically if somebody receives a document, he can verify that it's your signature or not. Okay, there are other things. Basically, whenever you want to have a secure transmission of information or documents or whatever, you can actually use this technique to be able to do that. The last thing we are going to talk about is teleradiology trade-off parameters. Basically, in any field, in any technology in general, you have certain parameters for the performance of that technology, and usually you have a trade-off between them. Basically, you cannot have everything going in the same direction. Basically, I can improve all the parameters at the same time. Actually, this never happens usually. Okay, for teleradiology, you have several sets of parameters. Okay, the first set of parameters here has image quality, turnaround time, and cost. Quality, of course, we know quality. Basically, we talked about compression. We talked about how to make the images as small as possible. And we actually, one of the things that we talked about is that if you want to have lossless compression, you're talking about compression ratios around 3, 5, something like that, something that is not that large. If you actually go to lossy compression, then you can get much higher compression ratios, okay? So basically, the compression ratio would affect the turnaround time, basically. Turnaround time means that how much time you will need to transmit the data sets, for example, okay? Because this would affect the turnaround time, meaning that the time to receive the report from the consultant would depend on the time you basically transmit the data. The longer the transmission time of the data, the slower the turnaround time. And also, if you're talking about the cost, then it might be actually if you're transmitting the data over the internet, and basically if you're paying the internet per size, basically sometimes actually you have to pay for the size of transmissions, basically. If this will actually be like a metered connection, something like that, then the cost is there also. Whenever you're transmitting something that is large, the cost will be high. If the quality is lower, if you're using a lossy compression, then the turnaround time will be faster and the cost will be less. Okay, so basically this is a very clear trade-off between these parameters. Okay, so basically these three parameters in general are affected by the method of image capture, type of workstation used, and the degree of image compression that you are using, basically. Okay, so basically these will be affected by, for example, if you're using MRI, for example, it's going to be different from using mammography, for example. Okay, MRI image sizes are not that large, but actually you have many images. Okay, for mammography, you have very few images, but they are very high resolution, very large. Okay, so basically the image itself, how you got the image, the modality that you use to get the image will affect the image quality. The type of workstation used means that, for example, if the image that you're using, or basically the workstation that you are using at the consultant side to view the images, if the quality of image, or the quality of the monitor, of the display monitor that you use is not that high, then the image quality that is displayed to the consultant will not be very high. And so basically you will have a problem here, because sometimes the turnaround time will be higher because the consultant will have to put some more effort, to actually try to get the diagnosis out of the images. And this will be basically translated to cost, because basically the time of the consultant is money. Basically, you have to pay him, the amount of time that he spent diagnosing the image. And also the degree of image compression, as we said, the higher degree of image compression, the lower the image quality, the lower the turnaround time, which is good, and the lower the cost, which is good. So basically, it depends on, if you look at the things that we talked about now, the quality and turnaround time and the cost, they all depend on image capture. So image capture would affect all of them. For example, if you're using a chest X-ray, for example, or MRI, okay, data sets like volumetric MRI, okay, then the data here will be very large. Here will be very small. So basically, the quality here will be basically very high because basically the data is very small. So you're transmitting everything. You don't have to compress anything. Turnaround time will be smaller. The cost will be smaller. For the MRI, the quality, if you want to maintain the quality here, basically you have to use less compression. So basically, the quality will have a trade-off with the turnaround time and the cost. The workstation, you're actually usually basically turnaround time might be actually affected here, but usually you're trading off quality with cost. Basically, I'm talking about how much money you're willing to pay for the workstation or for the display monitor that you're going to use on the workstation will be basically a cost that you actually have to pay at the beginning. This will affect the quality later. So basically, the lower the cost, the less the quality. And basically, this would be a problem, basically. You don't want to have that. You want to improve the cost, which means that the cost is less, but at the same time, the quality should be maintained. But there is a problem actually between these two. You cannot actually have higher quality and lower cost at the same time. Compression will definitely affect all of them, as we said. Basically, the quality will be less, and the turnaround time will be better, and the cost will be better. There's also communication technology is actually involved as well, because basically, if you're using an internet, for example, 1 megabit per second, for example, in some rural areas, actually, you might actually have very poor internet. Sometimes you don't have wired internet or fiber optic internet. You have very poor connections. So basically, you're trying to send images over mobile internet, for example. So basically, this will affect the turnaround time. And at the same time, sometimes, of course, when you use mobile internet, the cost will be higher. So basically, this is a problem. So basically, depending on what kind of communication technology you're using to transmit the images, there will be a trade-off between the turnaround time and cost. So basically, this is the first set. There is another second set related to data security, which includes patient confidentiality, image authenticity, and image integrity. Okay, what I'm talking about here is that basically image confidentiality, meaning the privacy that we talked about before, authenticity. This is basically the three things that we talked about just in a second, basically. Okay, so basically the data security is very important because basically it's very important to maintain the three because of the HIPAA standards. Otherwise, the software will not be accepted as a medical software or medical informatics software. And also, when you alter digital images, basically altering digital images is very easy. Basically, if I take an image like this, I can actually put something here. I can put a lesion here that would actually confuse the doctor, or basically make the doctor, put a wrong diagnosis there. Okay, if somebody is messing up with basically the images from a certain politician or a certain artist or whatever, he can actually make a person think that there is a problem with these images, but it's actually no problem. Okay, so basically, right now, altering a digital image is very simple. So basically, we have to maintain methods to protect the integrity of the data, which is actually very essential in radiology applications. Okay, so basically, in this one here, you have to make sure that the data security is there. And basically, whenever you do that, you're actually adding complexity to the system. Okay, so this is extremely important, but it's very much a requirement. You cannot actually go away from it. You cannot just ignore it, basically. Okay, because if something happens here to the integrity of the image, the consequences are far more profound than the cost that you're going to pay for, or the overhead that you're going to have for ensuring the three things that we talked about, the integrity in particular. Okay. Any questions? So basically, whatever we talked about is in this particular textbook and in this particular chapter. I'm trying actually to give you exactly the source that the chapter was based on, or the topic was based on, so that you can actually read a little bit more. Some of my explanation in the lecture will be there in text. So basically, some people actually like to read a little bit more, or sometimes I said something that you don't understand. If you read the textbook, you probably might understand it a little bit better. So I encourage all of you to look at this chapter here. Okay? Any questions about this part? Telemedicine?
Shukran. Thank you.
Okay. So right now,
Yes.
what we're going to do, I'm going to close this. Any questions? Okay. So what I'm going to do now is I'm going to close this presentation and open the next one for HIS, for Hospital Information System. Okay. Okay. So basically, this is the very much the last topic about the information systems in general. Okay. The last topic will be about the standards that we're going to talk about, where we talk about the DICOM standard and HL7 standard as the two most prominent standards in medical informatics systems. Okay. I hope to finish all these things for HIS and the standards part before Ramadan ends, inshallah. And then after Ramadan, we're going to have one topic about artificial intelligence in medicine in general. Okay. I suggest that the topic that we're going to take after Ramadan, inshallah, is not going to be included in the final exam, so that you can actually have time to finish your projects. And basically, the topic that I'm going to talk to you about in the artificial intelligence part is more like I'm just going to give you an overview of the technology so that you can be oriented, about what to look for in artificial intelligence applications. There are other courses in the program, in the master's program, that actually have actual applications of artificial intelligence in medicine. And basically, I just want to give you an outline of what to expect, the limitations of the technology before you can actually go into the details in another course. Okay. So now we're going to discuss hospital information systems. Basically, hospital information systems is, by definition, is a computerized management system for handling three main tasks in the hospital, okay, or in the healthcare environment in general. We're talking about, basically, you're talking about an organization. Basically, it might be an actual university hospital. It can be a general hospital. It can be a clinic or whatever. So basically, we're talking about healthcare facilities in general, okay? So the first one here, first function of the computerized management system here is to support clinical and medical patient care activities in the hospital. Meaning that, for example, something that like what we saw in the EHR, where we can actually schedule patient appointments, for example, okay? Something related to EHR, basically, whatever we receive, the reports that we receive for a certain patient are basically stored in the electronic health record of the patient, for example, okay? All things that are related to the, supporting the clinical and medical patient care are included in the HIS system. The other two are basically like business-wise, basically administer the hospital's daily business transactions like finance, okay, for example, the basically accounts receivable, paying bills, calculating the, for example, the personnel, the HR, the payroll, bed census. I'm not sure if you're familiar with this term. Bed census is like, you have statistics for how many beds are occupied in your hospital, and the activities in each one of these beds, like the daily activities, like the orders or the whatever the person is required to pay or something like that. So basically, this is actually very important to support the business transactions of the hospital. Okay, so for example, if you're ordering food for the basically the for the nutrition of the patient, you actually have to do that through this part of the HIS, for example. Okay, if you're paying bills for maintenance or whatever, or for basically you're paying the salaries of the doctors and nurses and biomedical engineers, this is actually a part of this part here. So basically, this is very important. The third part here is a little bit more futuristic, or basically it's not really, at least it might be actually in very large establishment. Basically, it's not really in very small hospitals or anything like that. So basically, you evaluate hospital performance and cost, and basically project the long-term forecast. So basically, here you're like planning or basically optimizing whatever happens here. So you're recording everything that happens. You start to look at trends. This actually needs something like an expert of planning or something like that, like a person with a business administration degree or something like that, so that he can look at the data and actually look for opportunities to improve the profit of the hospital, or look for ways to cut the losses in a particular area. So basically, this is like you're analyzing the data. Okay, analyzing whatever you get from the business part of the HIS, and trying to make sure that the performance or the utilization of resources is optimized. Okay, so basically now we're talking about something that has very little, or basically a partial component that is related to EHR, or basically related to the healthcare activities, related to medical side, and the other parts actually are almost very common with any other business. Okay, so basically these parts here, they might have some special things, like for example, the bed census is not, of course, it's not really in a company. Basically, you're not going to find it in a communication company, for example. But actually, as far as the other parts like financial, personnel, payroll, things of that sort, and the way of looking at the performance and costs and project long-term forecast, these are actually the things that you would expect in any business generally. Okay, so basically, as a construction, basically we're talking about what is HIS in itself. If you have a large-scale HIS, if you have a hospital that has a complete HIS, basically, large scale means that it's basically implemented all the departments. It does all these three functions. Okay, so usually it has a very large computer, like a mainframe computer, and you have a lot of software that would allow you to do all these functions. Mainframe computers were very common before, like maybe 20 years ago, when regular personal computers were not sufficient to do this. But usually now you can get a server. Server is much smaller than a mainframe, basically, and basically could actually do whatever you want, and basically it would handle all the traffic, and basically can do everything you want with a regular server, rather than, or basically a couple of servers, so that you can have a backup. And basically you don't really have to have basically a large hall full of basic computer hardware to do the functions of an HIS. Usually the HIS can be outsourced as customized HIS related packages. So basically you go to a company or go to a certain developer and tell him exactly, or tell the company exactly what you want, and it would customize a solution. This is very important, by the way, because the word customize is extremely important. So basically, if I wanted to buy an HIS, you cannot go like when you go to buy MATLAB or go to buy Word or PowerPoint, things like that. You just buy the same version that is basically sold to everybody else. For HIS, it's not like that. In medical informatics software, it's never like that. Okay, so basically, every company that sells HIS software, it tells you that I have a solution. Means that I have the packages that you want, but basically let me know exactly what you want, and I will take whatever I have and customize it to your needs. So basically, no two HISs are the same. So for example, I know for a fact that Siemens has a medical informatics part. Basically, it has like a part of the company actually does this kind of software. Okay, If Siemens, for example, installed a software in a hospital A and in hospital B, the same software, basic from Siemens, okay? If you compare the two, you will find that they are fundamentally different, okay? And this is actually very important to realize, okay? So whoever works in a company that sells this kind of software, he has to actually be able to customize the software package that the company offers so that it can meet exactly the needs of the hospital, okay? So this is very important. This is the most common option, basically. The other option is to have a team inside the hospital build the software from scratch. It's actually not from scratch. Usually you have open source software that are available, and basically I actually received one friend of mine actually sent me a website that has almost solutions for everything that we talked about in this course. Okay, basically all the things that we talked about, you can find open source software or available software that you can download and use to do exactly these functions. Okay, the problem with open source software is that they come with no support, basically, and you have to know exactly what you're doing. Otherwise, some of the open source programs actually might contain malicious software. Okay, so basically it might contain, because actually it's not like a page of code, it's gonna be like millions of pages of code. So basically it's very difficult for somebody to examine all of them. So basically, if you're not an expert, if you don't know exactly what you're doing, sometimes you can actually get an open source software that would be a security vulnerability in your organization. So you have to be really careful when you do that. So basically, homegrown, you're not gonna start from scratch. You're gonna start with open source softwares, but you have to really have good quality of software developers so that you can actually examine all the open source code that you have and make sure that they contain no security vulnerabilities. And you have to develop your own monitoring of such software so that if there is any unusual activity or something like that, you can detect that early on and secure your organization against any attack. Okay, so basically, like anything, basically, you can either outsource it, you can just get it from a vendor, you can give the vendor a very specific specification, very specific list of requirements, and he would actually deliver a solution that would meet them, or you can do that yourself. Of course, there are advantages to each one of these, but usually in present situations, because basically if you're going to get really high quality developers to develop that software, basically you're going to spend like, first of all, it's not guaranteed that you're going to get a very good software, by the way. This is a big problem because some things look very easy. And basically some things, you think that they will take a month to finish, and usually it takes more than that. And sometimes I show projects that extend years beyond the expected deadline. But actually, if it works, then it can be actually a very good thing. But the problem is that you have a team of developers. After they develop that software, they don't have anything else to do. They're just maintaining the software. And the maintenance of the software is much easier than developing the software. So basically, you're going to end up with a team that usually, basically, the software engineers usually are get paid a lot of money if you get good engineers. So basically, you have a budget allocated for a team that already developed the software and just maintaining the software. Unless you have a plan to market it, you be yourself a vendor after that. Okay. Usually, just to be clear, also. Almost all HIS packages were developed through integration of many information systems. So basically, it's not like one software, like for example, you have a code like one icon called HIS, and you run it and basically does everything. It's not like that. Basically, HIS is like a host of several programs running in parallel. Okay, they communicate with each other, but there are several programs, it's several packages. Okay, and we're going to see what these packages, what examples of these packages are. Okay, so basically, you can actually, in many cases, you can actually get a certain package from a vendor, another package from another vendor. That's why actually we talked a lot about compatibility, or what we called about interoperability between different packages, basically. And this is one of the things that the standards were developed for. And this is very important because you don't really have to buy everything from one vendor, because some vendors have very good quality RIS, for example, radiological information system. Some others have a very good quality pharmacy information system, for example, or lab information system, for example. So basically, you don't have to buy everything from the same vendor. As long as these packages satisfy the standards that we talked about in the EHR part of the course, then it's basically they should be interoperable, meaning that they can communicate with each other. You interface them, you can actually integrate them into your HIS, the whole HIS system that you have in your hospital. Okay. So as I was saying, basically most clinical departments in the healthcare center, mainly radiology, pathology, like this is a part of the lab, pharmacy and clinical labs, have their own specific operation requirements that differ from the general hospital operations. So basically you might have specialized information systems, like a specialized HIS for each one of these, but they are basically a little bit different. They work a little bit independently, but they are all under the umbrella of HIS. So HIS can have actually multiple HISs, multiple information systems that are specialized to different applications inside the hospital, but they are all integrated under the umbrella of HIS. Okay? So basically, as I was saying, basically I have, let's just, compare the two main components. Basically, you have the business and administration component, and you have the hospital operation component. The hospital operation component is the clinical part here. And this is the business part here. Okay, and basically these two components have multiple blocks. Each one of these blocks actually is a system by itself. Okay, for example, here, if you're talking about the business side here, you have accounts, accumulate payments, you have material services. For example, if you have certain like a store or something like that, you have to know exactly the inventory in that store. If you have, for example, budgeting, if you're going to buy certain equipment, or basically plan for the payments of the salaries, things of that sort, you have to have budgeting. You have payroll, you have cost accounting, so that you can, for example, you have different departments. Each department brings in a certain amount of money and spends a certain amount of money. So basically, you want to know whether surgery is making more money than radiology, or things of that sort, or outpatient department. So basically, you want to have cost centers. You usually do that in accounting. You have basically each one of these cost centers, you know exactly how much money they bring and how much money they cost you actually. And basically you try to see which one is more profitable, because this will affect the salaries of the people working in these departments, and it will affect also the plans of the hospital to expand such departments. So for example, if you have a department that seems to be very profitable, and at the same time it's very small, if you actually can, if you basically get some investment in that hospital, it's better to basically allocate it to a department like this. So basically, this is actually a part of the hospital business and administration component. It handles things like patient billing, okay? One of the things that actually we're going to talk about, what's called admission, discharge, and transfer, ADT, okay? And basically, this would know exactly when the patient is admitted, when the patient is discharged or transferred. And basically, it has basically based on whatever the patient does in all these departments, they actually get a notification here. There is a link between all the departments and this part here, so that as long as the patient is inside the hospital, whatever he does here is received here and is echoed in the bill of the patient. So basically, we all actually went to hospitals before, and at the end of the stay in the hospital, you just go to the accounts receivable and basically look at the bill and make sure that whatever you basically find there, everything that you did, if you did like
radiology, if you did like lab analysis, if you were visited by a doctor, something like that, you will find all these itemized here so that the billing of a patient is prepared here, and whenever the patient settles the payment, basically it should actually be reflected in that part. So basically there's a link between these two components. So basically for here, for example, also you have for the hospital operation component, you have something like OR scheduling, operating room scheduling. For example, you have 2 operating rooms and you have many surgeries that are supposed to be scheduled. You have to make sure that you schedule the surgeries properly. If there is a surgery for whatever open heart, for example, you have to give it enough time. If there is a maternal ward, for example, you know that the maternal ward would take a little bit less time. So basically, you schedule based on the information of the patient and the surgery. The nursing management means that, of course, you have to have nurses all over, all the time in the hospital. So basically, you have to arrange for the schedule for each nurse so that basically you maintain the presence of somebody all the time here. You can actually handle things like clinical appointments. If you have an outpatient clinic or something like that, you can actually do that from here. Basically, you have a lot of things that you can do also through the clinical part here. If you have also the clinical part of the patient admission, discharge, transfer is done here actually. For example, if the doctor decides that the patient should be admitted, it should start here and then get reflected in the business part of the hospital. So for example, if a patient goes to the outpatient clinic and the doctor tells him that he has to be admitted right now, then he goes to the business part, he goes to the admission office, which is a business office, and basically pays whatever he's asked to pay in order to be admitted, and basically he's now admitted in the hospital. If he's discharged, then the doctor would say that, and basically this would get reflected here, and the patient bill is prepared so that he can be discharged, things of that sort. So basically things start here and go here, okay? And of course, we have the radiology system that we talked about. We have also in the radiology system, for example, you have the scheduling of the examinations. For example, if you have an MRI machine and you have 10 patients, for example, you have to actually schedule them. You can, usually it's very difficult to do 10 patients, maybe depending on the time that you have your MRI open, or the working hours that you have at the radiology department. Basically, you see exactly how you're going to schedule them and basically send them to the radiology department so that you can basically know which one should go in first and then which one second, and so on and so forth. Okay. The part about the medical records, basically the EHR is here. Okay, so basically each one of these blocks is almost a complete software solution, basically, that can be independent from the other part, but all of them should be talking together, basically. Okay, so in general, HIS supports hospital and healthcare center business and administration functions. So basically you have hospital and business sides. Okay, it provides information or provides automation for such events as patient registration, admissions, discharge, and transfers, as well as patient accounting. Without doing that, imagine that maybe you didn't see that probably maybe 30 years ago. People, when they go to hospital, basically this was done in a paper form. Basically, you have to actually, whenever something happens, it goes as a paper to the billing here. Okay, and if there is a paper missing or something like that, then the patient has to wait until they find that paper, and basically if it's missing, then it's a big problem. Now everything is done digitally. It's connected, or everything is connected. Whatever is done here is reflected here right away. It can sometimes also provide the access that we talked about. You might actually provide online access to the patient clinical results, for example. Okay. Now we know that many hospitals, actually many pathology labs, for example, they can allow the patient to see the results online. So basically, they have the thing that we talked about, that is in the DMZ of the hospital, basically you have a server that you actually allow some of the data of the patient to be there so that he can access the data from home. He doesn't have to come to the hospital to get the report, for example. Okay, so basically this is also a part of the HIS. And as I was saying, the typical HIS has two categories of software packages, which are the business and administration. This is this part here, and the clinical operation, which is like right there. Okay, so each one of these rectangles actually contains a major component in each one of these categories. Okay, there might be actually other blocks other than these. Actually, there might be additional blocks, but all these blocks must be there. Okay. The software package actually, there's a software package called STORE, which is an abbreviation for Summary True Oriented Results Reporting, basically. This is actually like a way of communication between the HIS and any other system. So basically, this is a way of taking the messages that are supposed to be sent from any one of these systems to another system. And basically, it does it in what's called HL7 formatted data, which is actually, this is a standard format. And we're going to see that this is a standard format for communication between any medical informatics software. And basically, this allows the information to be transmitted securely and in a way that would allow interoperability. Okay. So in order for us to understand a little bit more, we're going to consider a very specific example of radiology information system, okay? Because basically, if you're just talking about a general HIS, sometimes it's very difficult to realize the small details about the specifications of such system, okay? So for the radiology information system, it is designed to support both administrative and clinical operations of radiology. And basically, the goal of this is to reduce the administrative overhead and improve the quality of service. For example, if I wanted to schedule a patient appointment in the CT, for example, okay, then it's actually, if it's done manually, then a lot of problems can happen. There might be a conflict between two doctors trying to schedule their patients, for example. There might be, the machine might not be working, for example. The technologist might be on vacation, for example. There is nobody else, nobody, in that shift, for example. There is another shift that has another technologist, but this particular shift doesn't have a technology. It had an emergency, for example, and had to leave, okay? Then basically what you're trying to do here is to automate things and reduce the administrative overhead. You don't have to do things manually, basically, okay? And whenever you do that, you improve the quality of service, okay? So RIS in general manages the general radiology patient information from scheduling to examination to reporting. Okay, so we're not talking about the image data here. We're talking about anything else. Okay, for example, if I have EHR of the patient, basically you can access it through the RIS. So basically RIS accesses the EHR of the patient through HIS and basically retrieves the data so that the doctor in PACS can actually have all the information to make the diagnosis. Okay, so basically it's related to retrieving the patient information and make that available to the clinical side. Scheduling means that basically it makes sure that there's no conflict between two patients, basically. Whenever I try to have an appointment on a certain machine, it has all the schedule of that machine, basically. And it makes sure to put the schedule in the right place without having any conflict with anybody else. So basically, the examination itself, basically, whenever the examination happens, it actually knows that the examination is done and knows exactly where the examination was sent for reading, and basically follows up on the reporting. Okay, and whenever that reporting is received, basically it takes that reporting and stores it basically in the patient information. Okay. In general, as a configuration, it's very similar to HIS. Basically, it has, it's basically the same structure, basically the same kind of blocks that you expect to see at HIS. You'll find it here because it has administrative part and it has clinical part. And basically it's just smaller, basically, because it's very much focused on radiology only. It doesn't have doesn't have to worry about pharmacy, or it doesn't have a store for medicines, it doesn't have lab results, things of that sort. So basically, it's just a smaller version of HIS, but specialized version. Okay. Usually the equipment you need for IIS is just a computer, basically. It's just a regular computer. It doesn't have to be a server or anything like that, okay? So basically, sometimes you call it an RIS workstation, which basically is one of the things that we probably saw in PACS. It's just a regular computer, basically, okay? So it's a regular computer. It doesn't have to have image display capability. It just uses a regular monitor. It might have a printer in order for, sometimes if you want to schedule an appointment for a patient, if you want to give them a slip or something like that, it might be a good idea to give it as a printed paper, something like that, basically. Then you need a printer. And of course, you need a network to be able to connect to both the HIS and PACS. We're going to talk about the interface between RIS and PACS very shortly, okay? Usually it maintains many types of patient and examination related information. For example, from the EHR, you have the medical record of the patient, you have the administrative record of the patient, meaning that basically if the patient is admitted on a certain date, this information should be there. You have the patient demographics, like all the patient information, the personal information of the patient, the billing information might be there as well. And it also includes the examination-related information, including the procedure description. Basically means that whatever the referring doctor wants to see, okay? And basically, if there is an urgency in the scheduling of, or if there is certain preference for the scheduling, things of that sort, it should be there. It has the diagnostic reporting. Basically, whatever the doctors in PACS basically wrote in their reports, it should be available there. It has a patient arrival documentation, film location. Basically, whenever the patient arrives, basically it's written that the patient started the examination at this certain time. If you have films, and this is like the old version, when you don't have PACS, you should actually have the film location here. If it's in PACS, then you don't have to worry about it, okay? The same thing for film movement. And basically, of course, you have to have the examination room scheduling inside the RIS. It's very important to think about how you're going to interface PACS with HIS and RIS. What we said about PACS is that for the doctor to be able to read the study, to be able to diagnose the patient, he has to have not just the images. He needs to have the electronic health record, some parts of the electronic health records. If he has any, basically, if you have lab analysis, sometimes he needs all the whole host of information in the electronic health record, in addition to the personal data of the patient itself. Okay, himself. Okay, so basically, you have to have a certain connection between PACS and at RIS and HIS, basically. Usually, the connection is between PACS and RIS takes care of the communication with the HIS. So basically, we consider RIS as a part of HIS, okay? Whatever happens between RIS and HIS is basically much simpler because basically RIS is actually an integral part of HIS. The first way of doing that is what's called workstation emulation. Workstation emulation means that if I'm working here on PACS, I'm working on the PACS workstation. And the PACS workstation, as we said before, this is a higher workstation or a higher specification workstation than the RIS. In the PACS workstation, if I wanted to get, based on this workstation emulation, if I wanted to get the patient information, I can open a window inside the PACS display. And this window actually runs an emulation program for the RIS workstation. So basically, I'm working here as if I'm working here. It's like remote login, for example. It's basically, as you know, remember the remote login protocol that we talked about on Windows, when we actually through Windows you can actually log into another machine and work on your computer as if you are working on the other machine. It's exactly the same here. You have an emulation window here, or an emulation terminal here, and you're working here exactly on this terminal here. You're basically working here in that window as if you are on the RIS machine. Okay, so basically whatever you want to see, you should be able to see here. There are several problems with that approach. Basically, the idea, first of all, is that workstation of one information system emulates the workstation of a second system, so that the data from a second information system can be accessed. Okay, so if I wanted information from here, I open an emulation window here and basically work on that emulation window as if I am on the RIS. Instead of having to go physically to a RIS workstation, I can work on it from here. So basically, the PACS workstation can be connected to the RIS with a simple computer program that emulates RIS workstation and perform any RIS function, such as scheduling neuroexamination, updating patient demographics, whatever, everything that you do, recording film, for example, if you want to have, if you want to say that the film was with me and then I'm going to leave it in that place, you can actually do that here. And actually, if you want to read the diagnostic reports, whether they are previous reports or whatever, any part of the EHR, you can do that from here. As I said, there are several disadvantages. Basically, RIS or HIS workstation cannot be used to emulate PACS workstation, okay? So if you're working here, you cannot emulate the PACS. So for example, if I'm working on the RIS and want to check the status of the work list of the doctor, for example, if you want to see if this report is done or not, okay, because it was not submitted, for example, okay, I should be able to open a window here and access the PACS workstation. Unfortunately, it's difficult to do that because basically the computer here is much less in specification than the PACS. So basically, it's not possible to do that. So basically, you can emulate the RIS from PACS, but not the other way around. The other problem is that usually the RIS software is different from PACS. Basically, the PACS systems are intended for doctors. Basically, they are basically used by radiographers who are actually, or radiologists who actually work to diagnose images. RIS is basically designed for administrators or nurses or technologists, things of that sort, but they are not for doctors, basically. In order for a doctor to do that here, to do that emulation here, he has to know exactly how to work on both systems. And this is usually not the case, basically. At least for doctors, they really learn the minimum they need, okay? So basically, it's not a good idea to try to teach them how to use RIS or learn how to work on RIS. The major problem actually is that even though I actually looked at the data here, I actually didn't transfer any information between the two. So basically, the information that is stored on RIS is still there. The information on PACS is still there. No communication of information happened because basically all I did here is to emulate the other computer or the other system, meaning that I'm working here on the other system. I didn't transfer, if I looked at some data from here, I didn't transfer such data to my system here. If I look, even if I'm able from RIS to look at the PACS, if I looked at a report on PACS, I cannot transfer that report to here. So basically, there is a problem here is that there is no data exchange. And basically, for the information systems in general to work together, you have to be able to transfer data between them. So basically, the second approach is to use what's called database to database transfer. So basically, you have systems here. You have HIS, you have RIS, you have PACS. If you have PACS, another PACS here. Okay. You have basically interface engines here that would allow you through HL7 to communicate with the other systems. So basically, there are several commands in the HL7 standard that would allow you to basically communicate any information between you and any of the other systems. So basically, you have multiple network systems that share subsets of their data, basically in a common local area. You can actually have things that are stored in a common area, or you can actually, transfer data from a database here to another database here, okay? Sometimes you can have a common database somewhere, and basically all of them are accessing that database, but actually it's common to have, usually you have definitely you have a database and HIS, so basically you can use that to communicate between the different systems. So for example, admission, discharge, and transfer data from HIS can be reformatted to HL7 standard, and broadcasted periodically to certain local database in HIS. So basically you have all the information here. So whenever I want that information, I can just access the database and basically get the information from database from any other system. Usually you can have TCP/IP transmission, basically just a network protocol, like a local area network protocol, basically. Can be set up between HIS and RIS, allowing HIS to initiate local database and broadcast ADT, admission, discharge, transfer data to RIS through either pull or push operations. So basically, you can have a database, and this database is updated, and basically, whenever it's updated, you can get a message here. Like, for example, on your phone, whenever you get a message, you hear a ring, for example, okay? This means that basically you have a database inside your phone that contains all the messages. Whenever something pushes a message, meaning that you receive the message, you get a notification, okay? If you're pulling a message, like if you're sending a message, you can actually get a notification as well. So basically, you have a notification of anything, of any activity that happens to that common database. Okay, and this is actually is most often used to share information between HIS and RIS. So basically, this is actually the one that is easiest to use and basically the most common because it's very simple. Okay, a common database that you agreed upon, and basically you all access such database through basically HL7, and you do that over the local area network, and that's it. The third approach, which is actually much more convenient, actually, and you can actually use it to interface the whole host of packages that you include in your HIS, which is what's called interface engine. This is actually, in general, this is the best that you can do, okay? But the problem is, it's in general form, it's intended for basically, it's not just, you're not assuming that all the information systems will just use HL7. You can actually assume that there are different standards. For example, if you look at the standards here you have HL7. Usually for the images, you use a DICOM standard. So basically, DICOM is a little bit different, okay? So now the interface engine handles not only the communication between the different information systems, it actually handles also the translation between the different protocols or the different standards. And this actually can be extremely interesting when you have legacy systems. Legacy systems that don't have HL7, for example. Then it can actually, you can add a module here that would be able to translate the, from that legacy system, for example. Let me write it here. Okay, so that you can interface it to all the other modules. For example, in some hospitals, they might have a module or a part of their HIS, it was basically installed in 1980s, for example, and it's still working fine, for example, okay? And you don't see any reason to replace it because basically your employees are happy with it. They are used to using it. They don't want to change it. So basically, if you want to change it, you're going to pay money, and you're basically going to have a learning curve for the employees before they are professional using it. So basically, if you want to keep it, you can actually use an interface engine to allow you to do that. Okay, so basically, if you have an interface engine, then all the information systems you have, or all the parts of the PACS systems you have, they can all communicate with the interface engine transparently in their own language, and the interface engine would actually understand their standard, and basically if they need to communicate with another system that has a different standard, it can do that for them. Okay, it's like basically you're sitting in a room with people from China, from Russia, from Germany, from Italy, from Spain, and from whatever, okay? And you're all trying to talk to each other, and basically you don't know the languages of each other, okay? So basically you bring somebody, you imagine the interface engine as somebody who knows all the languages in the world, for example, okay? And basically, whenever you say something to a Russian person talks to a Chinese person, he would take the Russian message and translate it to Chinese and sends it to the Chinese person, for example, okay? So basically, this is kind of an ideal situation, basically. And basically, whenever you see something that looks extremely convenient like this, it's usually very difficult to realize, okay? So basically, it's basically, we talk about basically, it's a single interface to access distributed data in a network heterogeneous information system. Heterogeneous meaning that different operating systems, different information systems that might have different standards. Basically, in operation, it appears that the user is operating on a single integrated database from his workstation. So basically, the communication goes without any, you know, you don't really feel that you have a different standard from the other people that you are communicating with. And the interface engine itself, the query protocol is basically, if I wanted to get information from a certain information system, for example, you initiate a query, okay? You have a certain question for a certain information, for example. So basically, the query protocol is responsible for analyzing requested information. You know exactly what you need, identifying required databases, see exactly where that information is, fetching the data. Basically, you communicate with the responsible information system and get the data from them, and assembling the results in the standard format that the original query initiator had, and basically present the information to them without any problems, okay? So basically, ideally, everything should happen transparently so that you don't really feel that there is a problem here. Basically, as if you are in a conference, you have instant translation, you have a headphone, and whatever somebody speaks in a certain language, you hear what is said in Arabic. So basically, you don't really have any problem with whoever is speaking, basically. But the problem is, in order for you to be able to build a universal interface engine, basically, it's usually not a simple task, as you can imagine, of course. Okay, if you just think about the language translation, it's very difficult to find somebody who knows all the languages in the world, for example, okay? And usually if you want to have multiple people doing that, then you're adding to the cost, okay? So basically, it's usually, such interface engines are usually done, for a limited scope. For example, if you have a certain hospital that has specific requirements, then you can do that. Other than that, if you want to have, if you want to build, if you are looking for an interface engine that would be universal, then it's probably difficult to find one. Okay. One of the things, by the way, EPR, by the way, here is basically sometimes it's EHR. Basically, it's electronic patient record. It's the same as EHR, electronic health record here. Okay, so that you don't confuse this. So basically, this is one of the parts of the HIS that you might actually. This is a database that everybody is connected to, basically. Basically, there are several reasons why we should interface PACS with HIS and RIS. Okay, first of all, the diagnostic process. Basically, as I said before, the diagnostic process is not based on the images, but just the images. Okay, the doctor has to have the patient information, the patient history, and basically, if you have other studies that patient had, or lab reports, or other analyses that the patient did, that the doctor should be able to access these so that he can come up with the correct diagnosis. So basically, this is very important. Okay, without the interface between the PACS and the HIS and RIS, you're not going to be able to do that. The PACS image management is very important as well, because basically, if you want to store the images, then you have to have the patient data or the patient information stored with the images. Okay, so basically, it's very important to have that. So basically, if you cannot just store the image by itself. Basically, you have to have the patient name, at least the patient ID. Okay, all such things have to come from the RIS, and it comes from HIS in the beginning. RIS administration, of course. If you're going to plan, the radiology department, you have to actually, have to think about that interface, for example. Okay, so basically, if you're going to plan how the radiology department will work, it has to actually involve the way of or reorganize some of the administrative operations that are carried out by the RIS. Okay, the PACS can provide the image archive status and the image data file information to RIS, and the RIS administrative operations benefit from the HIS by gaining knowledge about the patient admission, discharge, and transfer. Meaning that, for example, if the patient is still inside the hospital, you might actually want to keep the image data in the short-term storage, okay? Basically, you don't want to have it in the long-term storage yet, okay? When the patient is discharged, you might actually say that maybe it's we're not going to need that data right away. So basically, you can store it in long-term storage, and basically, if you need it in the future, it's there. But actually, as you know, the long-term storage will take a little bit longer time to retrieve than the short-term storage. So basically, this is one of the things that you gain access to by knowing the admission, discharge, transfer status. And this is obtained from the HIS by the RIS, and basically this is passed along to the PAC so that you can actually handle the images appropriately. One very important aspect, which is probably I would say that it's not common unless you are in a university hospital or something like that, which is research and training. Okay, this can be actually in such things as if you have a university hospital, then you have to train the new radiologists on cases. Basically, where are you going to get the cases from? Okay, basically, if the patient, if you have, for example, MRI, if somebody's basically specialized in certain certain basic MRI cases, for example, or basically in order for any doctor to see all the cases in different parts of the body, for example, you're not going to be able to make sure that the new patients will actually satisfy this. So basically, there are some cases that are kind of rare. Okay, so you want to use the cases from the database so that you can actually train the new doctors on them. Okay, so this is very important. Sometimes you can actually look at the data, and basically whenever you have accumulated database, you can actually use that database to develop artificial intelligence systems, for example. Okay, that's like what the thing that we're going to talk about in the last part of the course. So basically, this is kind of thing that you probably find in the databases that are available from certain hospitals or certain universities that are accumulated over time, and they are annotated, and they are probably made available for researchers to study, how to diagnose certain medical conditions. Okay, so this is very important. Sometimes it's very important to also try to analyze the data for certain trends. Okay, if you start noticing that the number of cases in a particular pathology became increase over the years, then you might actually want to stop and think about it. Okay, you collect some public health information in this case. If you're like here in the Saudi Arabia, I think there is a link between different healthcare organizations and the Ministry of Health. So basically, if there is a trend that is seen in different hospitals, then the Ministry of Health, which is above all of these and gets the data out of all of these organizations, might actually start thinking about making some effort to understand why there is an increase in these cases, and they might actually be a very good thing to do, because actually it might catch a trend that before it becomes a pandemic or something like what actually they did actually when they discovered certain variants of coronavirus, for example. Okay, so basically this is very important. I think it's probably we already took a little bit more time than last time, and I think it's I feel that it's kind of difficult to actually finish this today, because I want to give you a little bit more time. So basically, I think we should stop here. And next time, inshallah, we're going to continue the remaining part of HIS and start on the standards. Okay. I noticed that several of you didn't submit the project, the networking project. And one important thing I want to point out in the networking project, you don't have to submit a video, by the way. Okay, I'm sorry about that. I wrote something about submitting a video about the networking assignment, but actually you don't need to do that, because actually it's very difficult to you actually prepare the video for the networking part, because basically they are all things that you are going to try, things of that sort. So basically you don't have to do that. Okay, just submit the report and this should be sufficient. Okay, there will be another report that I'm going to post probably this weekend and discuss with you next time, inshallah. And this will be the last one, and it's going to be much simpler than the previous ones. Okay, it's going to be a research type, and basically I just wanted you to explore you know, things that we talked about. I just want you to look for practical or realistic applications that people do or use, so that you realize actually you know, a little bit you know, of you know, making you realize what goes on in the real world, basically, rather than the textbooks. So basically it's going to be very simple. It's going to be much easier than the previous ones, and this should be it, inshallah. Okay, do you have any questions? Any questions about the project? If you have any problem with the project, I actually had the only two students who submitted the networking project actually asked me several questions, and in some cases he asked questions and they found the answer before I read the question. But actually there were questions. So basically I'm not sure about the others. I hope it was okay for them, and I think inshallah it should be simple. If you have any problem, just send me a question about your problem, and inshallah I will help you. Okay, any questions? Okay, so inshallah I'll see you next Tuesday, inshallah. Okay, assalamu alaikum.
Salam.
عليكم السلام.